Hi everyone, I'm Jack. So today I'm gonna share a presentation of our cohort patient plan about Jackson. And my partner is Bailey, and we're from period 1.
While Jackson was attempting a basketball dunk, his right arm got caught in the hoop. His exam shows that he has swelling in his right proximal forearm, dorsal of the hand, and fingers. It also shows that he still has sensibility and vascularization in his right hand, showing that there were no nerves damaged.
So how injury affects the arm? When Jackson fractured his radius and ulna, it affected both the skeletal and muscular systems in his forearm. These two long bones run parallel to each other between the elbow and wrist. They allow the arm to rotate, lift, and support weight. So the muscles and soft tissues affect. Nearby muscles and soft tissue, like the brachioradialis, flexor carpi radialis, extensor carpi radialis longus, flexor digitorum, can become tight, weak, or sore due to the limited using during immobilization. Bone impact. The radius and ulna are responsible for forearm strength and stability. When they are fractured, the bones lose alignment, which can cause pain, swelling, and limited movement until they are set and healed. Joint and motion limitation. Jackson may have trouble with supination, pronation, and flexion extension. And then the healing process. When the radius and ulna are fractured, the body immediately begins a complex healing process that happens in several stages. Healing these bones usually takes about 3 to 6 months, depending on the type of fracture, age, and activity level. The goal is to slowly restore his range of motion, strength, and coordination so you can safely return to basketball. Timeline graphic. Week 1 to 6, bone healing, swelling control, inflammatory phase. And until 6 to 10 weeks, gentle motion, repair phase. Weeks 10 to 16, strength building, remodeling phase. 4 to 6 months, sport-specific recovery, strength recovery phase. And then I will talk about our exercise overview plan. After the radius and ulna fracture, the muscles and joints in the forearm become weak, stiff, and less coordinated because the arm was immobilized during healing. The goal of this exercise program is to restore range of motion in the wrist, forearm, and fingers, rebuild muscle strength and grip power, improve coordination and control for daily and athletic movements, prepare the arm for a safe return to basketball and physical activity. All exercises are designed to be progressive, starting gently and becoming more challenging as healing continues. Frequency: in-office therapy 2 to 3 times per week. Home practice 15 to 30 minutes daily, 4 to 5 times per week.
So, the first exercise that Jackson should do is wrist flexion and extension. He will practice this by bringing his wrist towards his forearm, which is flexion, and then bring his wrist away from his forearm, which is extension. This will help him reduce his stiffness, slowly regain his full range of motion, restore strength and improve his functional use, improve and increase flexibility in his wrist. He should do 10 to 15 times of this, 2 to 3 sets, and also repeat this daily. This is what his first exercise should look like. The second exercise that Jackson should do is forearm supination and pronation. He will do this by bringing his forearm perpendicular to the body, rotate his arm inwards, which is pronation, and then rotate it outwards, which is supination. This will help him prevent permanent stiffness, rebuild his strength and stability, reestablish his coordination between his ulna and radius, and also restore specific rotational movements, which are important especially for a sport like basketball. This exercise he should do 10 to 12 reps of, 2 sets, and repeat 1 to 2 times daily. Last but not least, Jackson should also practice grip strengthening. To do this, he should start with something small like a tennis ball or stress ball or wringing a towel. And later, as his strength improves, he should change to a professional hand gripper. Start with a lower resistance and then slowly work your way up. This will help him reestablish strength for his forearm movement, prevent stiffness and weakness that can lead to future limitations, boost his athletic performance, and also reestablish the link between his hand strength and shoulder stability. He should repeat this 10 times and do 3 sets daily.
So our encouragement and expectation to the patient. So I will give some encouragement and motivation to our patient Jackson. I will say, Jackson, you've already made great progress by getting proper treatment and following through with our therapy. Healing from a forearm fracture takes time, consistency, and patience, but your youth, determination, and athletic background are all in your favor. So what to expect next? Jackson will continue regular checkups with his orthopedic surgeon to make sure the bones are fully aligned and strong. Physical therapy will gradually shift from gentle motion and flexibility work to strength and sports-specific training. And last, thank you for listening. Thank you.